maybe we can start with just a quick introduction as to how you are related to the medical fraternity with respect to Canada, and how are you working in the COVID times? And also maybe if you can touch a bit upon, everybody's thinking about patients, everybody's thinking about the job loss and everything. Maybe less people actually know that there's so much pressure on the frontline workers. So maybe if you can, in the end, also touch about what does your day look like, and what all do you do?
Sure. So my name is Indy Sahota. I'm an emergency doctor in Mount Sinai Hospital in Toronto, as well as the Scarborough Health Network, also in Toronto. And I also work as an ICU clinical associate in Surrey Memorial Hospital. So I've been obviously fairly involved on the front line and to various degrees with what's been going on in the COVID pandemic. And I feel like being able to work sort of in Toronto, Vancouver, and in the suburb of Toronto has kind of given me a nice representation of how it's been handled in different places, and also the patient populations that are predominantly involved in getting affected by this. I also do some family medicine work, mostly in the walk-in clinic setting. So, and that obviously has altered dramatically through this time. A lot of family doctors, at least for a big chunk of their time, were not seeing patients physically to try and decrease the risk of infection within their clinics or to themselves and their staff. So that's sort of been an evolving world, and seeing that transition to telehealth and virtual medicine, it's interesting. I think there's going to be a lot of fallout from this that might linger, and I think the introduction of telemedicine services and its widespread use is probably something that's not going to go away.
Yeah.
But to answer the last piece of that, so I work predominantly as an emergency doctor, and it's interesting. I mean, and I've been asked this question a few times. On the one hand, it's a scary time for everybody. This is certainly a scary time for the general public, for patients, people with sort of significant medical issues or a higher risk, but also to the frontline staff. That includes your doctors, nurses, respiratory therapists, paramedics. There's a big crew of people that help, keep patients safe in hospital. So I think in the back of our minds, all of us know that we're at higher risk of contracting COVID. And I think that influences us at work. I mean, this sort of hinges on appropriate PPE, having good PPE access, which fortunately in Canada, for the most part, we have had. Mm-hmm. But it is a worry. It's a worry when you're coming back to loved ones, knowing that you're higher risk. You accept that, I think, sometimes as a healthcare worker, but maybe your family hasn't necessarily, but you're going to expose them to higher risk too. And I think that's probably the most troubling thing for people who are working the front line right now.
Yeah, you put it very nicely. And the issue we want to discuss is actually related to it. As far as I could understand reading the reports, this is something to do with so Dr. Sanjeet Saluja having to wear N95 mask to be able to treat patients, as I understand. One thing that was confusing to me was, this is in Quebec, Montreal. So when you are treating, and other doctors who actually have beard, have unshorn hair, and probably wear turban or bandanas. So are you supposed to wear the same mask as well? And if yes, then how is this different from what he was supposed to do, but then he was asked to shave to do the same?
Mm-hmm. So there are some nuances to the masks that we have to wear in the emergency department. So Dr. Saluja had shaved in order to be fitted to an N95 mask, so a particular type of respirator.
Okay.
You don't have to wear those N95 masks throughout the entire shift. So they're used only for what we call aerosol generating medical procedures.
Okay.
So that includes things like CPR, and it includes things like intubation, so the process of placing what we call a breathing tube and being attached to a mechanical ventilator. So there are certain high-risk procedures for which you have to use those masks. So it's a minority of the time that you're in the emergency department that you have to wear them.
Okay. Okay.
And so
So,
that's
so is
how it
that
works. The rest of the time, you wear what's called a surgical mask,
okay?
which are the ones, they don't have to have a perfect seal. You probably see them, they almost look corrugated in the front. They usually loop around the ears. You often see people wearing them outside. That's what you wear for the remainder of the shift.
So does that mean that if you were to be put into a condition of doing those things, you'll be asked to wear N95, and due to the instructions and the regulations, you won't be able to because of having a beard? Is that
Yeah, exactly. So the N95, the way it provides the filtration it does, which is sort of filtering out 95% of particulate matter to a certain micron length, size. The previous studies have shown that it only works effectively on people with clean-shaven faces, the men with clean-shaven faces. Now, I should say the research on this is kind of interesting. So a lot of this research comes from studies in the 80s. And at that point, they used to just compare essentially clean-shaven versus beards with no real nuance of length of beard. And so then we saw then that, clean-shaven is obviously a better fit than beards, so no beards. And then policies in hospitals since then have pretty much dictated across the board that you have to be clean-shaven at the time that you get fit with these masks.
okay?
And there's lots of different models. You get fit to a certain one, then you got to know that's the one you use next time if you have a procedure like this that you need the mask for. Now, there's sort of more recent studies in the last 5 years that have showed that there's probably a bit of nuance to it. So, for example, there were some studies that suggested, okay, well, if your beard is trimmed down to a certain length, 3 millimeters is what I saw, that you can actually you can successfully pass the fit test as well. So that's what I did. So I was like, I was not going to shave, but I'm okay trimming it down. I've been doing that anyway. So I trimmed it down to 3 millimeters, went for the fit test and passed.
Okay.
So since then I've been using it. But what's happened essentially is that I'm able to do it because this was a discussion with my chief of emergency and then occupational health, and they've said that's fine. But I don't have a piece of paper that I can then take anywhere else because it's sort of just off the cuff, in a way under the radar, because it doesn't fit with their policy and institutional requirements of being clean shaven.
Sure. No, that's very interesting because I think a lot of confusion when people were reading this news, and of course, being from a Sikh family, though I don't have one shown here, I've listened to this a lot that people worldwide are doing it. So why did he have to? So there's some important points that you bring up, that it actually depends on who's the person responsible within a hospital who makes these decisions. And if we go by the actual guidelines, they still do say that you have to be clean shaved.
Yeah, so across the board, hospitals now, including the hospitals I work at, would say you have to be clean shaven to be fit tested. I'm just bringing this up to you to sort of demonstrate that there's probably more nuance to it than just clean shaven versus beard.
Nice. So we all know that this is one aspect of it, which is the healthcare and the religion. But because this particular incident happened in Montreal, Quebec, this also has something to do with the ongoing Bill 21 conversation that has been actually, I think I was able to pull up a report very interestingly from Globe and Mail for 2013. So 7 years ago when this was first brought up. And actually Dr. Saluja talked to Globe and Mail back then.
Is that right?
Yes. And he said that it'll be really, really hard for me to keep continuing the service if this bill basically says that I wouldn't be able to wear my turban and do things in the hospital. I think luckily the bill ended up being that if you're in the police force and if you're a teacher and if you are in the law as a judge or a solicitor, that's when they don't allow. So they did not include doctors. So maybe that's why he continued working.
Mm-hmm. Correct me if I'm wrong. I thought there was also a clause that people get grandfathered into the program too. I might be wrong. I'm not an expert in
You're right.
this area, but I think there was something to that effect too.
Yes. So if you were in a particular position and you continue to be there for some particular time, you can be grandfathered as well. But the interesting part is that he actually is born and raised in Montreal, so as Canadian as they come. And he's also somebody who never even trimmed his beard before. So when I read this and then I read his current statements, I do believe him when he says that it's a very tough decision for me to do this. But what I want from you is maybe your perspective on, is this something that should be looked into as a decision that goes beyond just a personal thing, because this affects the whole movement of, let's say, the Sikhs who practice their religion and wear religious symbols, the Muslims who do this, and their constant struggle, especially against the Quebec government, to let them be as they are and still be able to serve in the public service. Do you think this particular incident can be used by the government or the lobbyists on the pro Bill 21 side to undermine those efforts?
Yeah, I think you raise a very good question. There's so many layers to this, Jas. So let's start with the simple stuff first. There are alternatives available for people currently who have long beards and do not fit N95s. So they're called PAPR systems, PAPR.
Okay.
They're quite cumbersome. It involves the use of a hood and a positive air pressure system. I won't get into the details. Mm-hmm. They're not as easy as just fitting a mask on, and their availability is limited across the country. But I just want to say off the bat that alternatives do exist right now, even if you take away sort of the experimental short beard length might be appropriate factor. So that's sort of one. And I'll just keep that out there because a lot of people probably don't know. This whole scenario with what's been going on in Montreal with this physician, I think there's a couple of big points I would want people to take away from it. One is that I've just, ever since I've been posting about it, I've been seeing a lot of sort of personal attacks on this physician for making the decision that he made. And I think the first thing I'd want to reiterate is that that is not for us to do necessarily. This guy was born and raised in Montreal. He's practiced there his entire career. Given the culture there towards people, so visible minorities, I don't imagine for a minute it's been easy for him to go his whole career looking the way he does in a place like Montreal. Yeah. So I don't think this is off the cuff. This was not a whim. This must have been a very difficult decision for him to make. Okay, and it's really not for us to be questioning his motive from now on. My problem, and I think what you're sort of raising, is what does this mean for everybody else now? And it's not just his decision, it's also the way it's been picked up and publicized. And I think that's what concerns me the most. In the context of it being in Quebec, that has this Bill 21 and has the relationship it does with visible minorities and religious wear in public spaces, right? Like, that's what irks me, I think, the most. What does this mean now for Sikh physicians who have full beards, right? Does this mean that anybody else around them is just going to point to the guy in Montreal and say, well, he's did it, so what's your problem? And in that sense, it could set us back a little bit. And then that's not, one could make the argument that he made the decision he did, but the fact of the matter is, when you're a visible minority, whether we like it or not, we get placed with labels, and individual decisions, especially when you gain prominence, are not truly individual. Yes. They're going to reflect the broader Punjabi Sikh community.
Yes, exactly.
And that's a big issue there.
Yeah. No, that's a very important point. And I think that goes both ways. As you mentioned very nicely, it goes towards our community that just blaming him and then saying he was never a Sikh to begin with, and he's done a grave injustice to us, that doesn't help. And on the other side, that also leaves us with, if you stand tomorrow and say, no, please help me find alternative measures because I like to keep having my identity as I do, it's easier for people to now point out that if somebody else could do it, why is your Sikhism different than his? So you should be able to do it as well.
It's tough. Like, I mean, I'm seeing elements of it now, right? Like, we're talking about pretty nuanced discussions. Like, within our community, we can sort of have these discussions, but the vast majority of other white Canadians are not going to sort of look at it. They're not going to see it like that. They're just going to see this one Sikh guy that shaved his beard so that he can wear an N95 and work. And they'll see the sort of heroic element to that. But they're not going to sort of understand the nuance to what this means to everybody else. And I think in a space where you're already a small minority of what everybody else around the table looks like, and you're already trying to fight for your place there. This makes our life a little bit harder now.
Yeah, and to be fair, I'm less, let's say, worried or concerned about non-Quebec provinces. Now being here for 10 years, I in general am comfortable to say that people are pretty tolerant and understanding of what different articles of faith are. But I do believe that, especially in Quebec, this would not be taken lightly for sure by the pro-lobbyists. Um, the last thing I want to discuss, and maybe it's more of a personal question, and please feel free to not answer if you don't want to. Um, Sikhism Sikhism is also a very, very complex concept for me, and probably for everybody who tries to understand it. So as far as I go, it's hard for me to say things like XYZ is not a Sikh if he doesn't do these set 5 things, let's say, about all the Ks. But then there are people who take it pretty seriously, and for them, Sikhism is about those 5 Ks. So, do you think it's hard for people in such special circumstances when they are given a choice where, on one side, as part of their religion, doing service is a big deal, which is a big part of Sikhism, and he said that in the things he told the news reporters, but he's also mentioned it pretty clearly that for me this was Seva, and I had between what I have been doing till now, keeping my Sikh identity in terms of unshorn here, versus continuing to do Seva because I feel people need me. This is subjective, and everybody would take different decisions given in put in different situations. So where do you stand with this? Do you have, as your personal guidelines, some things that you would never compromise, or you do believe that everybody would be able to look at it only when they are actually put into a situation, and looking from outside is very, very hard?
Yeah, I mean, I think what you're saying at the end, looking from the outside, is probably very, very hard, right? In general, for myself, I mean, my views of Sikhism, I feel like I've always resonated with the philosophy of Sikhism more than perhaps the ritual, quote unquote, of Sikhism. If you start looking at your 5Ks and all that. So I think for me, the decision, would be very different. Perhaps the Seva component would mean more to me, for example, than upholding all of the 5Ks in entirety, because obviously I don't do that now. Other people are going to think very differently, and they're probably going to disagree with what I say. And I think, if we let Sikhism be taken over by a minority of people that have very hardline views on things, and I think we're all going to suffer, or it'll drive the rest of us away. So I don't think we win from there. I think what sort of concerns me the most in this is again, it's not the decision, it's the context of this, right? And so there's some great articles that have come out of the UK recently too, about sort of Sikhs being a model minority with its history, and colonial Britain being sort of the martial races. This concept of sacrificing all the time, for the good of other people, essentially, for the most part. And it seems like this is just fitting into that narrative once again, that as a Sikh, you've got to sacrifice something that is important to you for the good of other people. And I don't disagree with that sentiment largely, but I think it distracts from the main problem, which is, why don't we have alternatives? Why are they not made available? In a place like Quebec that has things like Bill 21 and its pretty negative views of visible minorities, right? Those are the questions that we should be asking, because it's not really a choice if your adequate alternatives are not made available to you, right? When they exist. That's the nuance of the discussion that I think we should be having as a group.
Yes. Thanks a lot, Indy. Really, I actually expected the same. That is, talking to somebody who's not only supports the beard that is in question, but actually is in the front line, and actually the same country, Canada, so that people can listen from somebody who's doing the same things, like Dr. Saluja was put into. But thanks again for your time. And more importantly, thanks for everything you're doing.
Yeah, it's my pleasure. I'm happy to always chat if if there's anything else you want to talk about.
ਉਮੀਦ ਹੈ ਜੀ ਤੁਹਾਨੂੰ ਸਾਡੀ ਅੱਜ ਦੀ ਗੱਲਬਾਤ ਪਸੰਦ ਆਈ ਤੇ ਤੁਹਾਨੂੰ ਇਸ ਚੋਂ ਲੋੜਵੰਦ ਜਾਣਕਾਰੀ ਵੀ ਮਿਲੀ। ਡਾਕਟਰ ਸਹੋਟਾ ਨੇ ਕਈ ਗੱਲਾਂ ਸਾਹਮਣੇ ਰੱਖੀਆਂ ਜਿਹੜੀਆਂ ਕਿ ਆਪਾਂ ਨੂੰ ਬਾਹਰ ਬੈਠੇ ਨਹੀਂ ਪਤਾ ਲੱਗਦੀਆਂ। ਅੱਗੇ ਵੀ ਜ਼ਰੂਰੀ ਮੁੱਦਿਆਂ ਤੇ ਇਵੇਂ ਹੀ ਗੱਲਬਾਤ ਕਰਦੇ ਰਹਾਂਗੇ ਤੇ ਜੇ ਹੋ ਸਕੇ ਤਾਂ ਮੁੱਦਿਆਂ ਦੇ ਨਾਲ ਨੇੜੇ ਜੁੜੇ ਹੋਏ ਲੋਕਾਂ ਨੂੰ ਤੁਹਾਡੇ ਸਾਹਮਣੇ ਲੈ ਕੇ ਆਵਾਂਗੇ। ਧੰਨਵਾਦ।